Ladies and gentlemen, you are all warm welcome. Once again, a very interesting and very beautiful topic. So, this is Institute of Cosmetic, Aesthetic, Regenerative, Reconstructive, Functional, Holistic and Behavior. Of course, it is a research center. We shortly call it CARRF. CAF is a transparent name in laser in cosmetic gynecology. Let us see what we are and what message supposed to we are giving to the all the community of cosmetic gynecologists and cosmetologists. So, laser in cosmetology is our favorite topic. We have been practicing since 2012. We have started this practice as a regenerative surgeon in gynecology, as a PRP or stem cell or autologous consultant. Then journey was beginning and till this day we practice cosmetic gynecology with the help of energy based device. So, today our topics are filler only in cosmetic gynecology, not as a aesthetic or cosmetic reason, it is particularly specific for cosmetic gynecology. So, filler, hyaluronic acid, threads and PRP, these are a very popular topic and in general, but we specifically will discuss only on this topic. So, let us see what is the main purpose of fillers in cosmetic gynecology in female private parts. These are gel like chemical that are injected into the tissue to optimize structural and functional health. One useful method of cosmetic enhancement is the injection of fillers. Nowadays, within 1 to 2 years, it is the most popular method used as a filler in female private part, in vulva, in vagina and of course for mons pubis. So, these are the very useful tricks to enhance aesthetic purpose and of course for a cosmetic and functional purpose of the female genitalia. Indication: cosmetic fillers are indicated in structural female genitalia and specific disorder associated with the functional and psychological dysfunction. Basically, these private parts one cannot show in public. So, that is why it is a functional and also psychological. When any ladies see her private parts and if we can improve aesthetically and functionally, then of course it creates a more beautiful story. Okay? A pain remove કરવા માટે શું કરવાનું હોય? Okay. So, let us see what is the functional and psychological enhancement of the filler in our practice. So, which are the indication of filler in gynec practice, in cosmetic gynec? Basically, to improve labia majora part which may be hypertrophic or sagging. Second, in some patient congenital labia majora thinning or sagging is present, we can also use. After childbirth, there may be a dysmorphism in labial or private parts. After menopause, because of decreased collagen remodeling and elastin, so that is why we can use. Sometime in today's scenario, because of obesity is prevalent, some ladies prefer to lose sudden 20-40 kg. At that time there may be a labial thinning or pubis, the mons pubis part are thin out. So, that is why at that time to improve the beauty and functionality we can also use in weight loss, after sudden weight loss. Sometimes there is a labia minora hypertrophy to like equalize majora and minora, we also use these techniques as a filler. Vulval vestibulitis, this is also most common indication because it leads to the pain and decrease the lubrication, and also of course a major cause is vaginal laxity. So that is the all most common cause for the filler. So repeatedly childbirth, after menopause, sometime there may be a arousal or orgasmic disorder in female sexual dysfunction, and of course lack of orgasm, pain disorder, SUI, urinary incontinence, urge incontinence, and all the cause related to the lax vagina. So these are the most common indication of the filler. So now see which are the different type of fillers are used in gynecology, cosmetic gynecology. Most common and most popular filler is hyaluronic acid. Second is a calcium hydroxyl apatite. Third is a polyal lactic acid. Fourth is a polymethyl methacrylate, and of course patient self autologous fat injection. One thing I want to add more, that PRP also nowadays gaining popularity to use as a filler, but hyaluronic acid is the most commonly used filler in cosmetic gynecology. There are two type of hyaluronic acid available commercially: low density and high density cross-linked hyaluronic acid is available nowadays. So there are basically two type of hyaluronic acid: low density for rejuvenation and high density for tightening. And most preferable hyaluronic acid use is a cross-linked hyaluronic acid. We will later on discuss in our workshop what is the hyaluronic acid, how it is helpful. Now see what are the side effects of filler in general. First of all, there are less or rare side effects. Basically it related to the redness or the private part, labia majora, minora, mons pubis or around the genitalia, itching, pain, rarely necrosis if you do not know the proper practical management how to inject it. There may be allergic reaction, of course I have not seen any reaction. Edema may be present for minimum days, and if these are all the side effect present, and specifically with the hyaluronic acid, we can use antagonist as a hyaluronidase. So this is a very useful antidote for the HA or hyaluronic acid. For saving our time, I just speak hyaluronic acid as a HA to save our time. Now very rarely risk of the shock, different type of anaphylaxis, filler migration to the vascular part compartment, leakage from injection site, and there may be a nodular formation. If a newer cosmetologist do not know, then he try to just push on one side only, which lead to the nodules formation. Rarest rare, there are 2 to 3 papers present in net with some our Chinese friend show that the pulmonary embolism with hyaluronic acid is present and vascular occlusion are very rare, but life threatening, and I think 2 to 3 deaths also recorded in paper for this type of filler use. Now see what are the contraindication. We very well know age less than 18 years, pregnancy or lactation, or hypersensitive to injectant component. Like if we do not know which are the hypersensitivity which lead to the injected site hypersensitivity. So basically there is no proper guideline in India. So at presently as a good practice manual, we advise that age less than 18 years, we should wait till that lady became properly know all the reproductive tract external parts, and of course we cannot use in this pregnancy and lactation. Now sometimes there is a present of the vulvovaginitis, we cannot use filler or already implemented semi permanent or permanent procedures, that time we also avoid this type of fillers. Now see, if there is a cancer surgery or recent vulval surgery, we usually avoid filler. There is a recurrent herpes genitalis is present, at that time we also avoid these fillers. Rarest causes autoimmune disease, acute rheumatic fever with cardiac localization, we avoid all this type of filler, because at that time we also use autologous fat. So we have to stop this procedure. Now what is a post procedure care? Post procedure care must be taken to get the optimal outcome. Usually we give antibiotic, antifungal or antimycotic prophylaxis. Sometimes there may be herpes chances, so antiviral, Ocuvir or Acivir 400 milligram we can give. Local triple combination antibiotic, antifungal we can apply. Local hygiene as advised, that we should avoid the relation for given time, also abstinence for 7 days, and avoidance of the hot water bath, cycling and horse riding, so and maintenance of the hydration. These are all the precaution one should take, and doctor always as a cosmetologist, gynecologist advise to stop this type of activity. Now how can we assess the result? Because there is no certain criteria, we can always do before and after, before image and after image. At that time result can be assessed subjectively, like objective there is no any parameter, but in rare cases we can also subjectively and objectively can assess the patient as gaining fullness, moistness and feeling of the rejuvenation. So these are the criteria one should explain patient, that will notice after this procedure is a fullness, moistness and feeling of the rejuvenation. Pictures can be taken pre and post procedure to assess the difference between the before and after. We can also evaluate, yes, this is the very most common indication, that GAIS, Global Aesthetic Improvement Scale, we can use GAIS, Global Aesthetic Improvement Scale, and by that method also we can assess what is the improvement. Additional session may be needed to maintain clinically outcome. So my dear friend, one thing I want to always explain every newcomer cosmetic gynecologist, that never claim there is single session or like 2 to 3 session will improve or cure your condition. So always tell, yes, we will try, but it may be possible that you have to take it like a second session or after 1 year session if the condition is not improving. Now previously we explained all the fillers in general. Now specifically the most popular filler in the cosmetic gynec industries as a commercial use is the hyaluronic acid. So 50% of our body naturally occurring hyaluronic acid is present in our skin. So 50% of hyaluronic acid is present in our skin. Other organ are lung, kidney and brain, and of course in muscle. So this is a naturally occur thing in our body. So let us see what is the molecule of the hyaluronic acid, C14H221NO11. So this is the basic chemistry part. Now see what are different type of the hyaluronic acid. Basically there are 2 type of hyaluronic acid. Before starting practicing as a cosmetic gynecology, you have to know which type of hyaluronic acid you must purchase and advise prescribe the patient. So this is there are two type of hyaluronic acid molecule. One is a high molecule and second is a low molecule. So basic difference between high and low molecule HA is high molecule always remain on the surface, whereas low molecule penetrates into the skin and works inside. So that is the first and foremost thing to remember in hyaluronic acid. Now see, this is the beautiful figure with enlargement, how it works, high molecular HA and low molecular HA. High molecular HA remain on surface, so for regenerative purpose, whereas a low molecular purpose is penetrate into skin and work inside and core for the G short, O short, vaginal tightening, we can use low molecular weights. Now see, what is the physiological part and what is the pathological part for hyaluronic acid. So basically hyaluronic acid is present in our adult life, but as age increase, hyaluronic acid decrease with aging. So decrease elasticity and hydration, so lead to wrinkles. Now what is the property of hyaluronic acid? So basically hyaluronic acid is and remain in the half life is 24 to 48 hours, and HA is degraded by enzyme hyaluronidase. Third, hyaluronidase has an immediate effect and a half life of only 2 minutes, so very effective. Now this is already I have explained type of hyaluronic acid. There are two types, low density hyaluronic acid and high density. So indication of HA, basically rejuvenation of private parts of the female genitalia, vulvovaginal dryness we can also use, and atrophy and painful scarring when there is type of lesion is present, we can use hyaluronic acid. Yeah, as we know, some of the medicine are always used, and at that time we must do the allergy test, but in case of hyaluronic acid there is no need of allergic testing. Now come to our third part. We have completed filler in cosmetic gynecology, specific about the hyaluronic acid, and now come to the threads, a new topic, a new player, a new arrow, a new weapon in our part in for cosmetic gynecology. So let us see what is the threads in gynecology. So this is a symbolic presentation of the threads in gynecology. So this is different beautiful pattern to useful for the labia majora and mons pubis. Most popularly used threads is PDO. Now what is PDO? It is type of threads. So PDO stands for polydioxane, which is a common chemical compound that has been used in cosmetic gynecology. So most preferable threads is a PDO threads. The PDO threads absorbs in 6 months but help to stimulate collagen in 12 months. Now we have discussed only PDO, but thread which are useful in gynec are of three type. They are basically depend on their absorption, their length and their barb structure. So now what is the meaning of barb structure? So basically barbs is a structure which is used for fencing. That is the same way we have used in past for a laparoscopic myomectomy removal or adenomyosis removal. At that time, to avoid cumbersome stitching, we always prefer on those days in past a barb suture. This is the same one. So basically thread types are depend on absorption, length and barb structure. And specifically if we discuss a PDO, so PDO threads are of cog type COG, flat type, twist type and screw type. These are the 4 type of PDO threading techniques. Now, what is the basic mechanism of thread? So, mechanism of thread is basically a pulling mechanism. There is a pulling mechanism, so leads to the permanent fibrosis. This effect remain permanent. So, because of permanent fibrosis, this effect has also positive effect and of course has a negative effect. So, how? Let us see. The basic concept of cosmetic gynecology is to disrupt, or like we have to disturb the pattern inside the vagina, in a vulva, which lead to the increased collagen or fibrosis or elastin. But in case we use this thread, it causing the mechanical pulling which lead to the permanent fibrosis. So, that is the only mechanism. Now, which are the indication in cosmetic gynecology of thread? In which patient the threads are useful or helpful? First is the labial uplift, if you want to uplift the labia, female reproductive organ reconstruction of private part, and also vaginal laxity when also use this threading. Now, we already know that 3 most common indication of the threading in gynec, but which are the patient you must not do threads? First is the bleeding or clotting disorder, carcinoma of the genital organ, inflammatory disorder, pregnancy, or immediately after delivery during lochia secretion. Now, till this day people are claiming thread is almost 100% safe, but I think as a personal use there may be a chances of major 3 complication. One is a infection, second is a bleeding or smaller hematoma production, and there may be a chronic pain because of fibrosis. Now, we just discussed about the PDO threads, and depending upon the morphology, length and barb suture, we classified the thread, but basically chemically there are thread have 3 properties. First is a PDO thread, we already have discussed, it is a polydioxanone. Second is a PCL, polycaprolactone. So, that is the second one, PCL type of threads is available, polycaprolactone, and third is the PLLA, poly-L-lactic acid, and fourth one is of course barbed type of different suture are available. So, this is the પેલું auto power off બતાડે, આ કાંઈક power off કરો. So, sorry for interruption because of some technical problem, we have just started once again. So, let us see which are the different types of threads, chemical and their properties according to the chemical properties. First is the PDO, polydioxanone, PCL, polycaprolactone, PLLA, polylactic acid, and fourth one is the barbed one. Now, see, these are a different type of method. Diagrammatic and schematic we will show how we take a thread on different vulvar part and also of course in the vaginal part. So, this is a schematic representation. Sorry because I can't explain, because this all part we will cover in our workshop which is available, and we will beautifully explain all the thing till you satisfied. So, this is the only like showing which type of threads we use in gynec parts. This is a different method. Third is this is the pattern. We are just showing these two type of pattern, zigzag and vertical, but of course there are also different type of patterns are available. So this is the beautifully shortly I explain what is the thread. Of course I want to explain, I want to tell you something very new in first time in the cosmetic gynec history and in the cosmetic gynec industry, that as a cosmetic gynecology we have been practicing. My name is Dr. GAURAV CHAVDA and my colleague Dr. ALPA CHAVDA. We have been practicing in this field since 2012 as a regenerative consultant. Then we have started the stem cell practice. We have SAPEX and different type of all machine for laser, and also we have been beautifully done all the like surgically procedure for labioplasty, hymenoplasty. So then we just decided why we not telling or teaching all the person that want to become a cosmetic gynecologist. So we have prepared a beautiful course which is available online. So the course cover the topic different type of energy based device, laser, all you want to know until you satisfied, all the thing laser, XYZ, but be careful, it is only for gynecologic concern. We are not generally discuss about the aesthetic or like beauty parlor part. So we have just focus on the laser part, all you want to know until you satisfied. Then there is RF, radio frequency device, all you want to know until you satisfied. Then HIFU, ultrasonic that device, then electromagnetic device, the MCLA chair and that all the type of chair are available, that then plasma device, of course her plasma device, then carboxytherapy, its application as a cosmetic gynec, only cosmetic gynec, carboxytherapy. Then we also discuss which type of machine commercially available in India or we can import from the outside of different EVDs like lasers, CO2, then diode, erbium YAG, then triple laser, then HIFEM, HIFU, plasma, carboxy. We also show you how to compare a price, a quality and result wise, and also all the points is covered in this. We will also discuss all the terminology of the cosmetic, aesthetic, regenerative, reconstructive, functional, holistic gynecology, all part we will cover, and introduction to the cosmetic gynecology, like what is the cosmetic gynecology. We will explain very interesting, it is not boring, it is very interesting topic, female genital anatomy with for like cosmetic gynecology, female genital anatomy in relation to different types of EBD device, laser, physiology and pathology of genital rejuvenation. These are all topic we will discuss in this workshop. Then physiology and pathology of the vaginal tightening, STO and laxity, Botox, vaginismus, vulvodynia and Leber-Trainé syndrome. Of course, some of person also do not know what is this type of terminology. Then we will discuss chemical peeling and whitening of the private parts, threads in cosmetic gynecology. We have just, my dear friend, we have just completed only 1% of thread parts or cosmetic gynecology. If you are interested, you can most welcome to join this workshop or this course. Then fillers for the labia major and minor and female genitalia. We have discussed different type of filler names. We will discuss detailed procedure of how to use filler, which are the different type of fillers are available in the market, and what is the protocol. We will go also SOP for these fillers. Now body sculpting with the HIFU and all the different machines, and body contouring with the EBD, mommy's makeovers. Of course, we will explain in this workshop female sexuality, arousal, orgasms, and also female pain syndrome and female dysfunction in this type of sexually dysfunction. We also explain regenerative medicine, that which are the pharmaceutical drugs available for the cosmetic gynecology, and also cosmetic gynecology PRP and PRF part. Also explain O shot, G shot, P shot, CAM shot, H shot, whatever shot is available till you satisfied. Now also discuss stem cell, exosmers, surgical labial. Now these all are the non-surgical part. Now come to the surgical part: surgical labioplasty, surgical hymenoplasty, clitoral hood part reduction, enhancement, Mons baby surgery reduction, enhancement, only P repair, but it's not a P repair, it is a perineoplasty repair. We will explain what is different between the perineoplasty, how can you beautify all that parts, then perineoplasty, colporaphy, and also discuss the vulvar part of the infectious, cancerous and inflammatory disorder of the vulva and genitalia. So, and definitely we have taken one lecture of social media marketing for cosmetic gynecology. So, ladies and gentlemen, here we just know that we have to when we start any new procedure or like new branch, we distribute always distribute the pamphlet and newspaper advertise, and these are all the blah blah blah, but these are all only public relation. So, we will give you a secret mantra, a principle to become a very successful cosmetic gynecologist. We also show how to do the social media marketing and how to improve your practice. So, yes, my dear friend, we will also complete and cover. It is a practical approach for the social media marketing. You can also apply in your general practice or gynec practice also. Now, as I am also LLB. So, as a lawyer, we also discuss medical legal aspect of the cosmetic gynecology ethics. Of course, there is no proper guideline, but we will discuss ethics in the cosmetic gynecology. We will discuss on consents, protocols, SOP, how to take photographs, how to set up a cosmetic gynaec clinic, what is the anti-aging whole female body and genitalia. Of course, till this time we have to only discuss about the only female private parts, but also anti-aging part, newer trends. Of course, during this whole year, if there will be any new technique available, we will also discuss as early as possible. And we are of course first person in the whole India to come as a on online this type of course. We will provide in only one roof this all the different topics, and just introducing aesthetic part in short. So, at that time we also explain what is the hydra facial and hair removal and bikini spa, though it is not our area, but we will explain you very beautifully and very nicely. So, you can also judge yourself that am I a good person to do this all the aesthetic type, and if you will expert in this all areas, then we will also give a proper history of cosmetic gynecology in India and in world, starting from before ADPD or after that area. We will also discuss the all history of the cosmetic gynecology, and renowned laser cosmetic gynec in India and world doing cosmetic gynec practices. So, this is the different techniques which are generally practicing by the different cosmetic gynecologists. An aesthetic surgeon for all India and all over world will also give their different opinion. Different society and organization for the cosmetic gynec laser in India and world. We will also discuss which are the different society, like it may be a ISAG or it may differ on different area. We will also discuss that which are the society available in the India and in the world. એ બદલાઈ નાખજો હવે. એ ચેન્જ કરી નાખો, એક મિનિટ હું આ ડિસ્કસ કરી કહું તમને હું બે. And so will at present we had decided that we will cover more than 40 plus topic, okay, in depth, till you satisfied will cover all. It is our 100% pure promise. Every week our way of pattern is every week one topic which video presentation will provide you on WhatsApp, and will give you a 1 year access and 1 year our mentorship. So, till in 1 year we will try to make you a very expert person. We will also update any new things if arrive in market up to 1 year. For 1 year subscription we charge is 40,000, but my dear friends, as a gynecologist, we know we are not a businessman or we are not like running any commercial shop. So, we will offer early 20 registration with only 30,000 and giving more than 40 lectures, workshops, online training, and also give a 1-year mentorship. And also after all this, with some book, some PDF and some paper, after that every month will make one Zoom live discussion for doubt solving. So, this is all for you, only for you at present. For early 20% a doctor, only a gynecologist, or like DNB, DGO will also offer at a 30,000. So, this is a procedure how to you can enroll in our this workshop for 1 year beautiful with mentorship. For registration you have to give your name, your degree, your working place and city and course name and payment receipt, and this is our all defect, all detail for payment. Our bank is State Bank of India, account number, what is the IFC code. We also available, of course we accept all your GPay and PhonePe also online. So, this is the end of our 3 topics. First we have completed the filler, then we have completed hyaluronic acid, then we completed that thread. Now we switch over to the very popular and almost everybody know. Can you assume or can you guess? Yes, let us see. Till that time, if anybody have any questions in these threads, fillers, or like in hyaluronic acid, if anybody have any questions or like doubt, please write down. So, we will solve all the doubts. So, now as a regenerative surgeon proudly present PRP, a most popular and a magical like topic for our cosmetic gynecology or IVF consultant, and also as a general surgeon. So, let us see, it is a very popular among dermat, among orthopedic and also among gynecs. So, let us see and let us start PRP. So, first of all, as we know what is cosmetic gynecology, it is a wrong term. Instead of aesthetic and regenerative gynecology is a very accurate term. So, what is the need of the cosmetic gynecology? Female genitalia have some physiological and sexual function. It is not for aesthetic purpose. So, a branch in which different modality includes, in which non-surgical process and also of course surgical process is available to help to maintain above modalities. So, really cosmetic gynecology and PRP is work or is just gimmicks? Let us see. At the end of lecture you will must understand this all thing. So, human body either male or female have a same function and effect all over the body is same. So, if we take example, if we apply laser or a HIFU on face or on abdomen and if it works, then definitely if we use a very efficient, a very powerful machine with a proper knowledge as a gynecology, a mechanism, not as per that a commercial person will come and give the claim. So, it will 100% work on female genitalia. So, cosmetic gynecology procedure classification or regenerative cosmetic gynecology with platelet rich plasma PRP, stem cell, fat graft and exosmers. So, these are all the regenerative parts. Second is the filler. We just discussed before few minutes, hyaluronic acid and also botulinum. In laser part, generally diode, CO2, HIFU, HIFM, M-cell chair, universal chair, RF device for SUI, laxicity for improve the tightening, vaginoplasty, recurrent vaginal infection, dryness of vagina in menopause. All these are indication for regenerative and reconstructive medicine. And also of course a surgical part, a surgical cosmetic gynecology procedure, vaginoplasty, hymenoplasty, perineoplasty, labial enhancement or reduction surgery, clitoris surgery, mons pubis reduction or enhancement surgery. These are all the surgical parts, but with minimum pain and minimum operative time. Of course, we require some skill to do this all surgeries. So, now today we are going to talk on PRP therapy in cosmetic gynecology. So, introduction. PRP is a innovative regenerative novel therapy and modalities. It is affordable, simple, easily performed and effective. It is also non-invasive modality with a promising result and no side effect. It is a painless, no downtime, no need of anesthesia, walk in, walk out, a coffee break procedure. So, where to use? It may use in female sexual dysfunction or in male sexual dysfunction. In female sexual dysfunction, orgasmic disorder, postmenopausal vaginal dryness, decreased sexual drive, all these are the indication. And in male sexual dysfunction, erectile dysfunction and premature ejaculation. PRP therapy use in different shot, in female O shot, H shot, Kama Sutra shot, these are a different name, G shot and P shot. We will discuss all different type of shot in our workshop. It is a 1 year duration with mentorship and we are costing generally 40,000 rupees, but for early 20 gynecologists there are more than 50 plus gynecologists have joined this course and they are already satisfied. So, now this is for you. If you want to improve, you want to add some extra skill in your practice, you can enroll our course. We will give a huge, beautiful and very like big discount on this. Usually we offer this course at 40,000, but because you are like our prime doctor and has completed our workshop, so already like 10% our burden is like now lessen because of you already know everything about our lecture pattern. We will give a very good discount on 30,000 only for 1 year. Some inflammatory condition like decreased ovarian reserve and for thin endometrium also we use PRP. So, to start a practice as a regenerative gynecologist, we have to know what is the anatomy of the female genitalia. So, there is a corpora cavernosa of the clitoris, glans clitoris, urethral orifice, vestibular bulbs, crus of the clitoris, there is a vaginal orifice and anal orifice, and these are some of the injection site. So, for P shot and O shot, so we can use this different site. It is also useful in SUI combined with the laser and HIFU. We have put only question mark. So, why we have put question mark? Some doctor believes that there is no role of, it is only a gimmicks, but my dear friend, definitely there is a work with a cocktail pattern, like if you use plasma device or with radio frequency with PRP. Of course, a standard method to prepare to get a good number of that growth factor, you can improve immediately and see immediately result as a magic in case of SUI. Method available commercially in a market, you can also prepare in your clinic with standard protocols. So, what is a female sexual dysfunction protocols? Like there may be a arousal disorder, orgasmic disorder. I think study show that female have two type of orgasm. One is the clitoral and second is vaginal. Almost 95% ladies have don't feel vaginal arousal in his whole sexual life. So, with this method we can also can improve that vaginal arousal with this type of shot. Okay, ovarian rejuvenation study is going on. Some of the different protocol and different research paper are also published by different renowned gynecologists or IVF consultant, that is PRP or autosomal fat cell or stem cell are useful, mesenchymal cell are useful. So, I think there is a win-win situation, like some paper are published with that very good effect on ovarian rejuvenation in case of premature ovarian failure or ovarian failure, and some papers show that there is no effect like PRP or like a stem cell or like any exosmers. Thin endometrium protocol, every gynecologist, every IVF consultant nowadays regularly use this method to prepare 1 to 2 ml of PRP and they just ingest 3 days before transfer with a nucine or like this all hexagrast recombinant that molecule we can use. Okay. Now come to the cost. I think you think that there is a huge amount of payment is required to produce this type of lab or like to make this PRP, but my friend, it is unbelievable for you that a standard PRP technique cost only 150 rupees or less than 150 rupees. I know in market some of the person also claim that 100 rupees will make all the kit and will make a standard, but I think it is required 150 rupees and you can also make this kit yourself or like prepare the PRP. Otherwise commercially up to 15,000, 20,000, 30,000 rupees kit are available in market, but as a gynecology, as a cosmetic gynecology, we do not require this type of kit, and we will also explain how to prepare a kit, a standard kit with 150 rupees and make a good concentration of platelet and growth factor in this PRP 1 ml media. So, cost is about 100 to 150 rupees. So, what are the contraindications? Bleeding disorder, anticoagulant side effect, infectious disorder, and in like HIV or herpes we cannot do for short period. Want to become a cosmetic gynae consultant? Yes. If you want to become a cosmetic gynae consultant, we are ready to help you. So, what will be provided in our PRP module? We will provide you different protocols, which instrument supposed you have to purchase with proper cost or low cost, proper vendors, different kits and newer use of PRP, and also some of the pharmaceutical brands useful for PRP preparation. So, as previously lecture we also explained that this is the only one part of the cosmetic gynecology. If you enjoyed it, you can also join our other module like laser or EBD energy based device, IFU, Botox therapy, surgical cosmetic gynec and many more. So, how you can enroll? So, this is our enrollment. We have prepared a very good proper course covering all the topic, and if we forget anything, we will promise you that we will cover later on during whole year. We will discuss as a cosmetic gynecologist, laser all you want to know until you satisfied, radio frequency all you want to know until you satisfied, IFU all you want to know until satisfied, IFM chair all you want to know until satisfied, plasma device carboxy therapy in application in cosmetic gynecology, commercial availability of this all device laser and IFU and IFM and plasma and carboxy machine, very affordable rate which are the preferable, and it is verified by us Introduction to cosmetic gynecology, female genital anatomy with relation with the different type of energy-based device, physiology and pathology of genital rejuvenation, and many more topics like physiology and pathology of vaginal tightening, SUI, laxity, Botox, vaginismus, vulvodynia, Levatran syndrome, chemical peeling, whitening of private part, threads in cosmetic gynecology, fillers, labia minora and female genitalia, body sculpting and body contouring with EBD, mommy's makeover, female sexuality and female sexual dysfunction, regenerative medicine and cosmetic gynecology, PRF, PDF, PPF, and O short, G short, P short, Kam Sutra short, Kam short, H short, stem cell, exosmer, surgical labioplasty, surgical hymenoplasty, clitoral reduction, improvement, mons pubis, enhancement and shortening, P repair, perineoplasty, colporaphy, infectious cancerous inflammatory disorder of the vulva and vaginitalia. Of course, how to represent in a society commercially as a successful cosmetic gynecologist, as a social media marketing for cosmetic gynecology, medical aspect of the cosmetic gynecology, ethics in cosmetic gynecology, consent, protocols, photography, before, after, pre and post, how to set up a cosmetic gynecology lab, clinics, anti-aging whole female body and genitalia, also some medicine, newer trends in cosmetic gynecology, aesthetic part also we will discuss, as we strongly refuse that we will not discuss, but in this course we will also introduce to the aesthetic part for in short, but hair reduction, hair removal, bikini spa we will cover in shortly, history of cosmetic gynecology in India and world, renowned laser cosmetic gynec in India, who are the very renowned, how can you get assessed all those part, and in world who are doing successfully cosmetic gynec practices, different society and organizations for the cosmetic gynec laser in India. So, more than 40 plus topics going to be covered in depth. Every week one topic with video presentation will provide you on WhatsApp. 1 year access, my dear friend, ladies and gentlemen, and 1 year mentorship. We also update any new thing if arrive during this 1 year duration in a market. For 1 year subscription charge is 40,000, but for first early 20 registrant we will only provide 30,000. Every month Zoom live discussion for doubt solving with PDF of books, with PDF of some paper, also online support for 48 to 72 hours, as we are also leading gynec practice and IO consultant, also cosmetic gynecology. We require the 3 days duration. We will cover if we know, yes, we are doing evidence based cosmetic gynecology. If we know, then we will give you all the answer and we will discuss healthy, because I think there are so many, more than 50 gynecologists also joined this course and they are discussed in our very active groups. So, if you are also interested, you can feel free to join. Our payment detail, payment portal is Bank of State of India. This is our number, this is IFSC code. We also available on GPay, PhonePe, and for registration require name, proper name, because we also give the certificate of appreciation, degree, working place and city, course name, payment receipt. So, this all is required to join this 1 year. So, thank you so much, but how can you contact to us? So, ladies and gentlemen, this is only one number. Nine seven 27 99 4644. I repeat, 9727 99 4644. This is the same calling number and WhatsApp number. You just drop your query, your will to join this course on this number 9727994644. If a participant from outside India or outside of Asia, of other continents, please plus 91 is code of India. So, this is the code of India, 9 plus 1. Once again, what is the number? You just mug up 9727 99 4644. Our wall marketing team will always ready to help you. So, this is number for outside India or outside of India, outside of Asia, plus 91 you have to just add, and will always ready to help you to become a successful, transparent, cosmetic, aesthetic, regenerative, reconstructive, functional, holistic, and of course behavior cosmetic gynecologist. So, this is the end of wall lecture. I think I have taken your very precious 1 hour time. So, if any have any question, you can direct one to one encrypted you can send a message 1 to 1 on 9727994644. So, this is wall. Just I go away from this board because you can note down or photograph or take screenshot. So, next 5 minutes I am just waiting for any confusion or query. If you are not sending any query or confusion, I automatically like understand that it is the end of this beautiful precious conversation. So, let us see, anybody have question, we will discuss on it. Yes, one question. Okay. So, what is the method to enroll this course? Okay. So, basically you just give all the details and complete our formalities, then we will provide every weekly, I think every Sunday or Monday morning we will upload a one topic which is complete all the point like physiology, pathology, mechanism, indication, complication, side effect, contraindication, and lastly which are the different instrument easily available in the commercial market and which instrument one should or one must purchase to start good practice. So, this way every week we will send you detail of one video with all detail inside in it. Yeah, just it is thus like introduction. In our Gujarat, we are popularly tell it is a trailer. So, this is the 1 hour trailer. If you appreciate, then we will also give a whole picture like box office hit movie in detail every week, and we have taken so much pain to prepare all these videos. So, last 60 seconds and then we go offline. Yes, yes. There is a WhatsApp group is available. So, 24/7, 365 days. Yes, you have to just drop your question, your query, your problem, and your confusion, and we'll within a 3 working day we'll solve as we know. And what is available in this world, not is this universe, but on this world, in all 6 subcontinents, if there is any technique or mechanism available, we will try best one to tell you the solution. Yes, within working 3 to 4 working days, because as a we are not a like a commercial person, so we are also busy in gynec practice, but as a like course conductor or mentor will definitely solve all your problem and make a one private group to discuss. Yes, if you like completed your 1 year subscription, then also you will continue in this group, so you can also in future solve your problem, that's not worry. So okay, thank you so much. Jai Hind, Jai Bharat, Vande Mataram, and take care of our health.